大家好，我是黄伟恩医生，我是心脏及电生理学顾问。Heart failure affects 1 to 2% of the total population. That means in 100 people that you know, 1 or 2 may have heart failure. 6 to 10% of total admissions are due to heart failure. Risk factors for heart failure include ischemic risk factors such as diabetes, hypertension, and hyperlipidemia. Other risk factors can include strong family history of heart failure, heavy alcohol intake, and some medical conditions such as hypothyroidism. Symptoms of heart failure include breathlessness, swelling of the limbs, and fatigue. In order to diagnose heart failure, the doctor will need to assess the patient. We also use various investigations such as an echocardiogram and blood tests such as BNP. For heart failure can include medication, and traditionally we use ACE inhibitors, angiotensin receptor blockers, and beta blockers. Newer medications are now available such as SGLT2 inhibitors and the sacubitril valsartan medicines. With regards to surgery, if the patient has severe coronary disease which is not amenable to angioplasty or stenting, patients may need to have a bypass surgery. If the patient has got valve disease, the patient may also need valve repair or replacement. Physiology treatments for heart failure include device therapy such as implantable cardioverter defibrillators, which are devices that can shock the heart from a dangerous heart rhythm abnormality. We can also use cardiac resynchronization therapy, which are devices which can help to resynchronize an abnormally contracting heart. Ablation can also be used for patients who have dangerous arrhythmia from the top chamber called atrial fibrillation or bottom chamber called ventricular arrhythmia. If heart failure is untreated, the 5-year mortality rate is almost 50%, and this is much more than in cancer patients of colon cancer, breast cancer, and lymphoma. Prevention is key in the management of heart failure. If the patient has risk factors such as diabetes, hypertension, hyperlipidemia, this should all be treated well. Patients should be encouraged to have a healthier lifestyle, exercise, and eat sensibly. If you have symptoms of heart failure such as breathlessness, swelling of the limbs, or fatigue, please see your doctor who may assess you and refer you to a cardiology doctor. Majority of the causes of heart failure include ischemic heart disease, non-ischemic. Sorry. Okay, in order to diagnose heart failure, the doctor will need to assess.